of multiple vessels that also has fluid inside that performs three major functions. It works as drainage of excess fluid from the tissues. It absorbs fat and fat-soluble vitamins from the digestive system, and even acts as a defense mechanism through the lymph nodes and its organs to fight off bacteria, certain microorganisms, and certain diseases as well.
Now, Jason, what happens when our lymphatic system is damaged, either for one reason or another? We will be discussing one of the more common reasons later on. But what happens, Jason, kapag na-damage ang lymphatic system ng isang tao?
Right. So with chronic damage to the lymphatic system, you expect that the lymph or the fluid within the system cannot actually flow as well as in the normal system. And an immediate and often very debilitating concern that may happen is what we call lymphedema. This is where the limb swells, and it's not just found in the limb. No, you can also have lymphedema or swelling in the chest, in the face, and in the genital area.
Pag-usapan naman natin ang mga reasons or one of the more common reasons why someone might have lymphedema. Dr. Maya, let's talk about that, yung mga common reasons for this.
Any conditions that may impair the function of the lymphatic system will cause lymphedema. So we have certain infections, parasitic infections, such as that of filariasis, or what we commonly know as the elephantiasis. We also have certain history of thrombosis, venous thrombosis, that can also lead to impairment of the lymphatic system. And of course, certain conditions, particularly cancer treatment, that also affects the lymphatic nodes, that impairs the function of the lymphatics, leading to lymphedema.
Now, let's talk about the reason why someone may have lymphedema due to cancer. Dr. Maya, what types of cancers are usually seen with this complication of lymphedema?
So lymphedema would usually present later on the course of the treatment of the patients. Most cancer patients will be undergoing certain therapies and certain treatment because some malignant cells can invade the lymphatic nodes. The treatment will sometimes involve removal of certain of the lymph nodes, and even the radiation therapy or brachytherapy can destroy these lymphatic nodes, leading to impairment of the lymphatic system, leading to lymphedema.
Now, Jason, ano yung main symptoms nito? Bigla-biglaan bang magkakaroon ng swelling for someone who's had cancer treatment for this?
You know, Doc, that's the interesting about lymphedema. There is no set, a specific onset, for example. Just to give you an idea, I've had some cases of lymphedema coming to my clinic 2 weeks after surgery. I've also had cases where the patient had breast cancer surgery 10 or even 15 years ago. So there's really no specific date of onset. But one thing we did notice is that the closer it is to surgery, actually within 2 years from surgery, then your risk is about 56%, especially if it's axillary dissection. And then as you go further away from surgery, then your risk does drop naman.
Jason, are there any things that people can do post-surgery that can sort of help prevent this lymphedema?
Yes, absolutely. Lymphedema, especially if you search this online, if you see the pictures, it can be very scary, very traumatizing to see these pictures. But I'd like to emphasize that lymphedema is a preventable disease. So immediately after surgery, and this is also what your surgeon recommends, you have to move your arm, especially if it's a breast cancer surgery. Exercise after surgery, of course, within the guidelines provided by the surgeon, is very important in preventing the occurrence of lymphedema. Another thing that we'd like to focus on is your weight. So we'd really like to get you within the normal BMI or normal weight range appropriate for your height. One thing that recent studies are pointing to is that obesity or higher weight gain can actually predispose you to to having lymphedema.
Now, according to the CDC, lymphedema can be caused by cancer or by cancer treatment. Here in the Philippines, breast cancer patients in particular are most at risk of developing the condition. More on this when we return. We're your partner in healthcare. You're watching Net Talk Health Talk.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan ni gimuha sa SMC ang pag-uswag o pagbuo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao para sa Mindanao. SMC Davao Cement. Ato ni Bay.
I'm Dr. Freddy Gomez, and welcome back to Med Talk, Health Talk, where caring is our calling. Now, many people battling cancer are at risk of developing lymphedema, a condition that occurs when our lymphatic system isn't really working as they should. Doc Maya, continuing with our discussion, could you tell us how cancer leads to lymphedema?
When we have cancer, this usually involves, especially that of the malignant type, not the malignant cells, can go beyond the area of involvement. And these malignant cells can travel and invade the lymphatic nodes. And because of that, this would lead to obstruction of the lymphatic nodes and eventually leading to lymphedema.
So just a reminder to our viewers, you must continue with the treatment for any cancer that you have despite the risk of having lymphedema. Now, the purpose of this episode is to show that there is options if ever that lymphedema may occur, which is why I'd like to ask Jason, when it comes to lymphedema, is there certain stages of this, mild, moderate, severe? And is therapy or treatment applicable to all stages?
Absolutely. Lymphedema has certain stages, and we always use the ISL, or the International Society of Lymphology, staging guide. So for ISL, it actually runs from stage 0 all the way up to stage 3. Stage 0 lymphedema, this is what we call also subclinical lymphedema, or lymphedema is present but there's no apparent swelling. What some patients feel are actually the symptoms. So for example, you have in breast cancer patients, you have heaviness of the arm, you have some discomfort of the arm, you also have a feeling of tightness around the arm. Stage 1 lymphedema, on the other hand, has some mild swelling. No? Nagsisimula ng lumaki yung arm or yung leg. Stage 2 lymphedema can progress from stage 0 and stage 1 if there is no treatment involved. And then this brings us to the pinakagrabe na stage, no, which is stage 3 lymphedema. So this is what you usually find in the pictures when you search online. So this is swelling extremities, but more importantly, there are skin changes.
How can the proper diagnosis of lymphedema be established para maumpisahan yung treatment ito?
Even among physicians, the awareness of lymphedema is still not that widespread, especially here in our country. That's why we are increasing, we are trying, together with Sir Jason, we are really promoting increased awareness of lymphedema. And primarily because this is a diagnosis of clinical presentation. Through clinical investigation, by history and physical examination, we can determine if the patient has lymphedema based on their history and their conditions. But we do use certain diagnostic tools to also confirm if there is indeed obstruction in the lymphatic system. So we have the lymph scintigraphy, which is nuclear medicine diagnostic test that gives pictures of the lymphatic system, and we can actually see if there is an obstruction. The ultrasound of the extremities also helps us see if there is significant edema, if there are also other conditions such as thrombosis or blood clots within the veins. And then aside from that, we have the MRI lymph scintigraphy as well, which utilizes the MRI in providing us a picture as well of the lymphatic system. And together with that, we can also identify if there are certain malignant cells that are actually obstructing certain areas of the lymphatic system.
So now that we've established the correct and proper diagnosis for lymphedema, Jason, let's talk about yung actual therapy for lymphedema.
The treatment is called complete decongestive therapy. We use a combination of physical modalities, for example, specific exercises. We use compression therapy in the form of either a bandage or a stocking. And also, most importantly, is we do manual lymphatic drainage, which is a series of skin stretches that actually resemble massage. So it's very, very relaxing for the patient. But at the same time, this relaxing technique will also give you very, very good clinical outcomes. You will really see very good decrease in your size of the arm or leg, and also reduction in your symptoms.
But maybe a lot of people who are watching this who do have lymphedema might be asking, maibabalik pa ba yung same symmetry? Will I have the same size of my arm, same size of my leg before I had lymphedema?
It's quite difficult for us to get exactly the same measurements that you had, or comparing at least to your normal arm. It's difficult to make it exactly the same. But one thing that's guaranteed is that there will be a very visible reduction in the size of your arm. And also another important thing, aside from the reduction in size, is the improvement in your quality of life. Because as much as possible, we'd like to get you back into your normal daily activities with very, very little inconvenience to you.
Now, Doc Maya, are there any limitations? Jason mentioned some exercise, some physical manipulation, massages and such. Are there any limitations? Are there some contraindications with lymphatic therapy?
That's why before we start having the decongestive therapy, it's important that the patient will be cleared by a vascular specialist in order to make sure that there are no other conditions that might become a problem during the therapy. Primarily the presence of blood clots in the venous system as well. And of course, we also need to look at the patient's heart and make sure that there are no other conditions that may impair their ability to undergo the therapy. Patients who might have symptoms of heart failure might not be able to tolerate the therapy because of the excess fluid that might compromise the function of the heart. So these conditions should be cleared by their doctors first before undergoing the therapy.
Seeking early diagnosis and getting that treatment is key in having successful treatment. When we return, we'll talk about life after lymphedema. Your health is our mission here on MedTalk Health Talk. We'll be right back.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglago sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao para sa Mindanao. SMC Davao Cement. Ato ni Bay.
I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. Now, living with lymphedema can be a very big challenge, but there are steps that you can take in order to control the swelling, the pain, and get back that quality of life. Doc Maya, once treated for lymphedema, pwede ba itong bumalik?
Yes. We don't actually say that a person with lymphedema will be totally healed. So this is a chronic condition that you may have a certain course of therapy, but that will still be continued with a good lifestyle, proper way of doing your daily activities. And you still have to go back to your therapist regularly to have this, to at least make sure that the lymphatic flow is already still maintained.
Now, Jason, for those who are interested in having their lymphedema treated and they do undergo the therapy and see very good results, significant results, how do they maintain it to have less chance of it recurring? Is there a change of diet, change of lifestyle? What should they do?
For lymphedema, the patient has to do the exercises regularly, and also they have to be maintained on very good compression garments, so stockings in this case. And I'd like to point out that the quality of life after receiving treatment is very marked. And also, as to the diet, it would follow mostly the general healthy diet that we espouse. No? One thing that we should reduce is the intake of salt, definitely, because that will help puff up the extremities again.
Now, Doc Maya, for those who are interested, do you have any tips on how they can get in contact with maybe groups? Are there any support groups for those with lymphedema or for added awareness regarding lymphedema?
As a vascular specialist, now I belong to the Philippine Society of Vascular Medicine, and the Council on Lymphedema comprised also of lymphedema specialists who also trained abroad to also bring back here in the Philippines the training and also establish clinics that would address this problem. So there are certain institutions already, certain hospitals already with lymphedema clinics, and they can ask their doctors if they can be referred to a vascular specialist so that they can be diagnosed properly.
So as more and more cases of cancer do arise, we get higher and higher chances of a lymphedema patient suffering or having this complication. So the more awareness that we give people out there, the better that we can be able to properly diagnose and properly offer treatment as well. Before we go though, Jason, do you have any tips or final words for the viewers?
Essentially, what I'd like to really encapsulate is that there is definitely hope when treating this disease. It doesn't matter if the lymphedema started 2 days ago or 2 years after your surgery. There's definitely hope. And I'd like to also share with you a group that I founded. It's an online group. It's called the Philippine Lymphedema Network. So just type this on Facebook, and then you'd be directed to a site that actually shows the before and after pictures of some patients. And also it provides you a venue where you can interact with a lymphedema specialist. And also it will provide a venue where it can direct you to a qualified lymphedema practitioner that's closest to your area.
And with that, I'd like to thank cardiologist and vascular specialist Dr. Ramayana Diaz Garcia and certified lymphatic therapist Jason Francis Rojas for being with us today, sharing this very important awareness for our viewers. We appreciate your time and your insights very much. I'm Dr. Freddy Gomez, and we'll see you again next time here on MedTalk Health Talk.